so we are currently in the waiting room, waiting to be called back.
I have to pee so bad, but I'm holding it in so we can see our baby better.
If you want to slide down a little bit here. Yeah. Perfect.
Oh, cool. You guys have a whole screen there
you can
too.
see right up there. Yep. So if you want to just lower these for me.
Okay.
I like that outfit, by the way.
Thank you.
It's cute. Tuck this under. Try to print some cute pictures for you to take.
Oh, thank you.
Should be nice and warm. Do you mind scooting this way just a little bit? Sorry, I know I'm like down, up. Also be taking measurements as well. Okay. To be able to give you an estimate on baby's weight.
It's a little sticky. What is this? It's like a cream.
A jelly, yeah.
Oh, his head is down? Really? Oh, he's like kind of like in a crawling position.
Yeah, so looking at placenta still, and then we'll get to baby.
I can't believe how big he's
No,
gotten.
they go fast.
Well, you can leave it.
Oh, okay. Oh,
Yeah.
Oh, you're trying to spread it.
No, you're fine. I'll do it with the,
Okay.
helpful though. I appreciate it.
Mhm.
So fluid around baby looks good. Gonna go ahead and start looking at baby's spine. Good. Yeah, baby's looking straight down right now. See that spine there really well.
Like a long spine. It's probably not really like that.
All the way to baby's little bottom there. That's fine. Nice.
Yeah, it's my first child, so like this is all new to me.
Yeah.
But it's so cool. How does the spine look?
So the spine looks good. So ultimately, the doctor has to look at all these images and everything.
Oh, okay, so now we're just like taking photos and
Yeah, just taking pictures, and then the doctor will read through everything.
Oh, like
and
today,
then-
or is it like another day?
So you'll get the results another day. The doctor reads through it, writes a report, and then sends it to your doctors.
Oh, what is that? Is that just like the fluid inside?
So the color is going to be blood flow. So that's the umbilical cord right there that you're seeing.
Because it has been a very healthy pregnancy, which is like crazy. Because I have friends that can't get out of bed or anything, you know, and I'm already like going to my 5th month. And yeah, the first trimester, the very beginning, I was feeling like a little bit like nauseous, but it wasn't bad, you know.
Yeah.
Yeah. So I'm like, the baby must be very healthy. It kind of almost seems like surreal sometimes, like because sometimes I forget I'm pregnant, you know.
Yeah.
So I'm just like want to make sure that everything's
Yeah, of course. Here on baby's belly.
Oh, it's a belly. It's normal the position he's in, like facing down, because usually they're facing up.
So baby's actually has the head down. So baby's head is down, but just looking towards your back. If that makes sense.
Oh, so we probably won't be able to see the face today.
So I'm hoping baby turns around. This is what I was talking about babies being a little stubborn. I'm able to get all these other pictures so far, so I'm hoping by the time I go to look, baby will have turned.
So, just to kind of, like a quick question, let's say, hopefully, like you said, he knows and everything, but let's say I get closer to my, like labor, like in my due date, and I'm already starting getting contractions, and the baby's like down like this. I would have to get a C-section.
So baby, you actually want baby's head to be down. So that's
Yeah, babe. Yeah, because
Oh.
it's down.
Oh,
it's
but
not like.
down this
Yeah, it's not like
way.
towards
Oh,
your
okay.
chest.
baby's
It's not
down
towards
right
your
here.
chest.
Baby's head's here.
Yeah.
Oh,
Right there, so
okay.
that's good.
Yeah.
I mean, that's what you want.
That's- yeah.
But right
Yeah.
now, baby's still little. That can change.
Yeah.
Yeah.
By the end of this ultrasound.
Got it.
But in general, that's where you want baby to be.
Yeah. Oh, look at this ribs.
Yeah, you can see little stuff there.
That's so cool.
Yeah, they don't even start like thinking about that until like 36
Later,
weeks
okay.
or
Because
anything
I have heard crazy stories like, yeah, they didn't want to move, so they had to
No, but
open
baby's
me.
even in the right position, so
That's actually really cool.
that's good. Like I said, baby's already moving a lot here. Look at this.
So like, what is this? Because they could feel the radiology, the.
Yeah. Well, that's nice. Here, baby's head. I have to push it over here. Look at the head moving around.
Mhm.
Yeah.
You just keep moving that head. I'm like chasing the head around. Okay. Nice.
Yeah, ever since they first took my first ultrasound, they said that he moves a lot.
Yeah. These pictures. Good. I'm going to measure babies back here.
It looks like a big head.
There. Look at that. Maybe a little
Wow.
flip. There we are. That little hand is kind of like right in front of
I can already see his
face.
little features. That his nose.
Yep, this is the nose right here. Right there. And a little flip. Look at that.
I think that's your nose, babe.
So, like, are their face developing now, or like, it's a.
So they're pretty much. I mean, I can see.
They're pretty much formed already.
Yeah.
Wow.
Yeah, I can see baby's nose and everything like that.
I'm sure if I do like, cause is this considered 3D or 4D?
So this is actually 2D.
Oh,
So
okay.
I can do. I was actually gonna try as soon as I finish.
Oh yeah, no, finish first, finish first. Oh, the heart. Oh, look at his beats.
Mm.
It's like beating.
Lots of pictures of the heart.
Oh, I see the heart beating. That is so cute. So the heart is also like good straight or.
So I'm gonna listen to baby's heart.
Oh, okay. Yeah, you can't do the. Is it?
It's moving a lot.
Yeah, trying to. Yeah. Just enough to make it. To get us still. There we go.
Is the spine supposed to look a little crooked like that?
Yeah.
Okay.
So it's just like ours, how it kind of like arches. It's another vessel that takes blood into the heart. And we're gonna really look at some of the vessels here in baby's heart.
That's so cool how you guys can see all this.
Yeah.
It's amazing.
Yeah, we can see very detailed in baby's heart and everything. Seems like a lot. These are all normal pictures that we have to take. It's moving. I hope it gives me a couple more seconds here in the heart before we decide to turn. More.
This heart.
Yeah. Right there. Look at that.
Wow, it looks like a strong heartbeat.
Nice.
It's like they can listen to everything now.
Yeah.
Mm.
Just watching that blood pump in the heart. I'm going to listen to baby's heart rate. Breathe in. 120 and 160 is
Okay, awesome.
oh, nose.
Oh, where is it?
Here. Right in front, of course.
Oh,
Here. Little nose.
oh, yes, his hand,
Yeah.
arms.
Yep. Letting it around there. So right here, you can see is this tip of the nose, nostril, nostril,
Mhm.
oh, mouth. That little hand is like
Not property.
back, yeah. No. Now baby's like perfectly looking up, but also
Honey moved again.
Yeah.
Left leg. This is the little thigh. Some bone in the leg.
It's crazy how the woman's body can be
I
pretty
know.
this. Like, it's crazy.
Yes.
Just a little nervous for labor now, but I'll be fine. I know we're built for this. This is crazy. Oh, the
Yeah, little legs. They're right next to each other.
Oh, and is that his
So-
little pee-pee?
Look at it. Just yet.
Oh, okay.
Here.
Oh my
This is the little
god.
lower leg.
They look so long, but I know they're zoomed in.
Yeah.
Oh my gosh.
Right there.
Oh,
Left
that's
foot.
so cute.
Cute. You can see the little toes.
It's adorable.
Like that.
No, this is just like the back or something.
Still looking at that little
Oh,
leg here.
at the
Just
light
got
of
a
the
little
light.
better view. To take a look at the right leg. Right here.
Yeah, he's ready to get out.
Yeah, baby has them like kind of like crossed here, so you can see they're
It's
kind
like-
of bent at the knee. See right there?
Oh, yeah,
it's
his
like
legs.
folded. Yeah.
That's so funny. He's just chilling.
Yep. Just relaxing.
Oh. It's crazy how I haven't felt him kick yet. Like, I felt little flutters here and there, but
So you're just think of that little leg. So your placenta is what we call an anterior placenta right here. So that means that it's on the front part of your uterus. So baby right now, for you to feel it, has to kick through that placenta for you to feel it.
oh.
So sometimes they say that like that could be why you don't feel as much.
Is an anterior placenta, is that like normal?
Yeah.
Okay.
That's normal. So as long as it's not close to your cervix, which it's not, it's fine.
Got it. So sometimes people have their placenta in the back.
here. Yeah.
Oh.
So it just depends on where it.
And that's why you'll probably
developing.
feel it more.
Yeah. So
Yeah.
right here, see how baby. So I'm coming from up here. Placenta's here. Baby's here.
Got it. No
So
wonder.
right now, baby's having to like kick through there.
He has to like really kick
He has
through
to, like,
there.
kick really hard.
Yeah, because baby's still tiny. So, but sometimes the placenta can. be
Oh,
like
look.
that.
He's
like,
kicking a little
Yeah, you
bit.
see
Yeah.
that? That's not even me moving.
He's
He
kicking.
is kicking.
Yeah.
And his fist. He like kind of gave a little
Straight trying to punch it.
If my placenta wasn't there, if my placenta wasn't like that, I'm sure I could feel this baby kick all the time.
Does the placenta location change like every time you get pregnant, or is it like that's how
Yeah.
it's party?
Yeah, it just depends on where it develops.
Mm.
Oh. So it could be different with every pregnancy?
Yeah.
Oh, okay.
Like next time you could have a posterior one.
Mm.
So right there, it's right between the legs.
His little thing.
Yeah.
Oh. Is that his booty
It's
too?
like a little, yeah, this baby's little bottom right there. But definitely little boy parts. Right.
Oh my gosh. Once he gets bigger, like I know I'm 5 months, but like let's say when I'm like 8 months, for example, will I be able to feel him kick by then, or it still he would have to like
No,
kick very hard?
you would still feel under.
Oh, okay, okay.
That's just like earlier on they say that. Some people say they don't even feel a difference, but
Got it.
Mm.
just
But it makes sense
could
though.
be, yeah. And the thing is, like I said, baby's very zoomed in right now, but
Mhm.
baby's still very tiny.
Yeah.
So, like as you get further along, it's not as much baby. You'll feel baby kicking around. It's just
Got it.
so right now, baby's pretty much the size of your placenta. So right here. So
Yeah.
this is
Yep.
placenta right here. This right there.
He's moving. Oh my gosh.
Yeah.
He moves
He
so
hasn't
much.
stopped. Look at that foot. Look.
Oh.
Can't even
Yeah,
catch
he's
it.
kicking.
Yeah.
Yeah. It's like, let me out of here.
Those little toes right there.
Yeah.
Just so quick. It's like
That's so funny. He's very active. Are babies usually this active?
yeah. So it just it depends, but
Some babies I'm sure are more calm.
Yeah.
Like,
that's very nice. Now you can see that little those lips a little better right there.
the word?
A little front of the face. Right there.
Right there. Oh.
Those are the eyes.
Oh,
Right there.
oh, I see the
So
eyes.
those are actually the lenses
Oh, wow.
in the eyes, right?
He's like blinking.
Right there.
Wow.
This is- So I'm actually just sweeping forward, so you're seeing like the inside, and then you're seeing like eyelids.
Oh.
Wow.
Yeah.
So they blink, or is their eyes shut the whole time?
They open their eyes.
That's
But
crazy.
Mm-mm.
I thought their eyes were always shut until they were born.
that's fine. Very nice. Got this on. Double check. See the little knuckles.
Mm.
Oh, I see. Okay.
Right arm.
His arm's hitting my placenta.
Yeah.
Oh, is that 50? I mean 40.
Mm.
Oh,
He has my nose.
Right there. You can see part of the little arm. Right there, that's in front. I'm trying to take that out so you can see his face.
Yeah,
So baby kind of moved, so see how it's kind of like
oh
blurry
my
on the other side, but
gosh.
you can see part
Oh,
of
wow.
the look, and it's also,
That is crazy.
also the arm is like right there.
Oh my gosh, my baby. That's crazy. He has like big lips too. Oh my god.
You can see a little bit.
Okay, that is so crazy.
There we are. That's a good
Oh my
one.
god.
That is a very good one.
Yes. Oh, his lips.
Mm.
Yes, daddy's lips. That's crazy. Because my lips are like thick all the way around. You can tell his
Yeah.
upper lip is thinner than his bottom lip.
In front, so it's good that we got that one when we did.
Yeah.
There's another here that's gonna be
Yeah, now he has his hand like, leave me
right
alone.
away, yeah. Look,
Like-
that arm's just like this.
Like I'm stressed out.
Yeah.
Oh my gosh. That is crazy. And they say these pictures are pretty accurate when they're born, right? They like actually
Yeah,
look like
sometimes I
that.
see people like compare them and they
Oh.
look pretty, like I said, right now baby is kind of moving in some of those, and baby's still small. A lot of the ones like when baby's further along is actually,
So he has to grow a little bit more into his features, but basically it's gonna be very similar.
yeah, it's even not so much the features, it's more of like baby kind of right now is more like just so tiny, it's a little bit more like chunk.
Oh, more
towards the end,
chunky.
yeah.
Mm.
Kind of fills out a little more right now. But here.
Oh, one thing I didn't notice was his ears, but I'm sure that was in the head part, right? You can't really see that in the ultrasound.
Yeah, you can. It's,
Or you probably, yeah, you would have to like turn his head, but like when the face you can't. Cause it's
yeah,
on
when
the
you look
side.
like straightforward, yeah.
No.
That's it.
I'm done.
All you get.
That's so cute. Oh my
Yeah,
gosh.
it's like no more.
Okay, so all his parts are made. Okay, that's good. So it's a little nerve wracking because it's like this is
No,
the
of
anatomy
course.
test. Hopefully the
Right.
doctor's
Uh-huh.
notes and everything comes back.
So, 15 ounces right now is what baby's weighing. So 16 is a pound. So basically,
Wow.
basically a pound.
He's actually-
Baby's measured bigger.
He
Yeah.
is bigger. Oh, so he might be he might come a little earlier.
So not. That's hard to say. Not
It's hard to say.
necessarily.
Mhm.
Yeah, baby just might be on the bigger side. But they'll use it kind of like just to reference, just to make sure baby's not getting too big or anything like that.
Got it.
Other than that.
And does it look
good,
like
though.
it's still going to be due November 23rd? I mean, I don't know if you guys could even
Yeah,
tell.
so
but
that's like I said, that's
something.
hard for us to say. We just use that date as a comparison.
Got it.
Just to, like I said, like a reference point to say like, oh, is baby measuring too big? Is baby measuring too small? At this point, we use it to compare.
Got it.
Does
And
that
right
make
now
sense?
it's like still like
So measuring like a couple days different, but
a couple days like different, like earlier, a little bit, or
4 days ahead.
oh, okay.
So it's
Okay.
not that much, but it's,
Yeah, yeah.